And the last one is through heterogenic transmissions. So already we have seen heterogenic insect transmission. இதெல்லாம் பார்த்திருக்கோம். இப்போ கொஞ்சம் detailed we will see. Okay. So when you take contact transmission, there will be direct or indirect transmissions will be there. So direct transmission means the pathogen will be directly transmitted from one person to another person. That is mostly sexually transmitted diseases are transmitted directly. Example, syphilis and gonorrhea will be example for direct transmission. And if you take indirect transmission, mostly the fomites. What are fomites? Fomites. Have you heard about the word fomites? Fomites are nothing but the materials, okay, such as clothing, pencils, toys, and from these materials we are getting the infection. So mostly the direct contact transmitted diseases are called as contagious diseases, and the fomites transmit, that is the infection transmitted through these inanimate objects, that is non-living objects, are infectious diseases. This is regarding the contact. This is one method of transmission. And the next one is inhalation. Respiratory infections, mostly it is transmitted through inhalation through nose. And what happens in inhalation is that, so when a patient sneeze or cough or when he speaks also, what happens is the microorganism will drop into the environment. So when the microorganisms drop in the environment, it will become dry. Okay, pathogens which can resist the dry conditions can be a causative agent for respiratory infection. So what happens is when a deceased person or a patient cough or sneeze or speak, from taking him as a source, what happens? The microorganism will drop on the surrounding environment. This organism will become very smaller droplets in size, and it will become very dry. So those microorganisms can survive even in dry conditions. The size of that droplet will be very small, in the case of 1 to 10 micrometer in diameter. Those droplets, when it comes into, they can survive in the environment for longer periods, and when the healthy person inhales those droplets, he will get the infection. The droplet is called droplet nuclei. Okay, the microorganism will shed into the environment as a droplet, and it will become dry, and only the nuclei part of that organism will survive in the environment. That is called droplet nuclei, and it is very minute in size, that is in micrometer in size. When it comes in contact, when the healthy person inhales the droplet nuclei, he will get the respiratory infections. Can you understand? இப்படிதான் respiratory infections டைரக்டா பேஷண்ட்ல இருந்தும் you will get it, but sometimes இந்த மாதிரியும் you will get it. அதனால தான் கொரோனா எல்லாம் வந்து respiratory infections we are putting mask. It can be present in the droplet in the air. From the air also it can infect you. Airlayum corona வந்து droplet nuclei can be present, and if you inhale you will get it. Prida, these are regarding contact and inhalation methods of transmission. And next one is ingestion. So ingestion is done by intestinal pathogens. So mostly ingestion is taking inside. So these types of transmission causes intestinal infection, gastrointestinal infections. If it is waterborne, it causes cholera. If it is foodborne, food poisoning. So name any bacteria which causes food poisoning. ஏதாவது ஒரு bacteria சொல்லுங்க food poisoning க்கு.
Staphylococcus.
Yes, good. So Staphylococcus is an example for food poisoning. So இதெல்லாம் ingest பண்ணிட்டீங்கன்னா it will cause foodborne diseases, and handborne diseases are dysentery, and recently there are fingerborne diseases are also there, which is transmitted through nose, air. So if your hands are infected with any organism, if you touch your nose, if you touch your ear, and if you touch your mouth, infections also cause like corona. So these are different types of infections, intestinal infections caused by ingestion. And next one is inoculation. Inoculation and what is the meaning of inoculation? What do you mean by inoculation?
Transferring from one medium to another.
Yes, good. Okay, transferring from one medium to another in which the microorganism can multiply. So in this case, inoculation in the sense, if you have any wound or anything, it will directly multiply in the tissues. For example, if you take tetanus spores will be multiplied in many deep wounds, and rabies virus multiplies when a dog bites. The rabies virus multiplies in the bite area. And there are also iatrogenic infections. What are iatrogenic infections? நேத்து தான் சொன்னேன். Iatrogenic infectionsனா என்ன?
Non-infectious that are acquired from the physicians.
Yes, from the physicians. So from the physicians in the sense, how they are transferring us through infected syringes, okay, surgical equipments. If they are all infected, you will get the infection. That is, the physicians are inoculating the microorganism, inoculating the pathogen through these infected hospital equipments. So that is an iatrogenic infection. Another one is HIV. HIV is majorly caused by inoculation. How? Can you explain? HIV, how it is transferred? Through blood layer. So how? HIV க்கு இந்த inoculation meaningல எப்படி HIV transmit ஆகுது? Direct contact இருந்தாலும் HIV will come. Inoculation in the sense, in the point of view, how can you explain HIV transmission?
Same injection use பண்றதுனால கூட
So this is a type of infection. So same from the drug addicted patients, if you are using HIV infected and drug addicted patients, if you are using the same needle, inoculation of that HIV will be inside the healthy patient. So this is a method of transmission. So இது வரைக்கும் என்ன பார்த்தோம் ஞாபகம் இருக்கா? So these are all எல்லாமே ஒரே மாதிரி இருக்குமா? நேத்து பார்த்தது types of infection. இப்போ பார்க்கிறது எப்படி வந்து infection transmit ஆகுது. One is through the direct contact and another one is through the inhalation. Inhalationல வந்து என்னென்ன வருது அப்படின்னா respiratory infections, how the respiratory infection causing microorganisms survive in the environment through droplet nuclei, and when you inhale the droplet nuclei, you will get the infection. And the next one is through ingestion. Ingestion in the sense, what all the food we are taking, water, food, idellame vandu direct nose, air and mouth la vandu contact irunduchina, you will get the intestinal infections. And the next one is inoculation. Inoculation is directly into the wounds. The tetanus spores and rabies virus will multiply, and also through the infected needles and syringes, and the HIV is also one example. Then this one already we have seen through insects. Major method of transmission is through insects. What are mechanical vectors?
Transfer of pathogen from one to another.
Example? Yesterday I told example.
Housefly, ma'am.
Yes, good. Biological vectors?
Mosquitoes.
So what is the difference between mechanical and biological vectors?
Mechanical vectors will only be on the surface. It won't get inside the host.
Okay.
Whereas biological vectors, for example, mosquito will suck onto the blood and then transfer it to some other person.
Okay. Another major thing is biological vectors will multiply inside the host, and when it reaches a particular life stage, it will cause the infection. Okay. What period is that?
Extending incubation period.
Okay. அப்பா ஞாபகம் இருக்கு எல்லாருக்கும். Extensive incubation period. Good. So this is regarding insects. The next one is congenital infections. Congenital infections வந்து நார்மலா வந்து if infection is passed through the placental barrier. Okay, placenta la வந்து ஏதாவது infection இருந்துச்சுன்னா it will directly affect the fetus in the uterus. Okay, so this type of transmission is called vertical transmission அப்படின்னு சொல்லி சொல்லுவோம். ஸோ இப்போ மதருக்கு வந்து யூட்ரஸ்ல ஏதாவது இன்ஃபெக்ஷன் பிளசண்டால ஏதாவது இன்ஃபெக்ஷன் இருந்துச்சு அப்படின்னா இட் வில் டைரக்ட்லி பாஸ் ஆன் டு த ஃபீட்டஸ். And when the fetus is born, what happens? The fetus will be with abnormalities. Sometimes it will lead to abortion, miscarriage and stillbirth. இதெல்லாமே வந்து vertical transmission ஓட disadvantages. So vertical transmission னா உன்னோட மதரோட பிளசண்டால வந்து இன்ஃபெக்ஷன் இருந்து it is passed on to the fetus and this will lead to miscarriage and abortion. And so sometimes live infants, when the infants are born, they will be affected with congenital malformations. This is due to rubella virus. So if the intrauterine region of the mother is infected with rubella virus, what happens is this rubella virus will interfere with the organogenesis. Organogenesis na enna? What do you mean by organogenesis? Organogenesis. From the name you can say. What is organogenesis?
Development or formation of organs like as a baby when it is a embryo stage.
Yes. That is
stage.
Yes. So that is organogenesis. So development of each organ. So since it is infected with rubella virus, it will lead to some malformations in each organ. And this type of infection is called teratogenic infections. Okay. So when the infant is born with any congenital malformations and which is due to the defect in organogenesis caused by rubella virus, that type of infection is called teratogenic infections. Can you understand? இதுதான் வந்து பேசிக்கா கான்ஜெனிட்டல் அப்படின்னு சொல்லி சொல்லுவோம். அண்ட் ஸோ என்ன ஆகும்னா ஃபர்ஸ்ட் ட்ரைமெஸ்டர் பிரெக்னன்சி அப்பவே வந்து the fetus will be affected with first trimesterலே வந்து organs will be formed. When during pregnancy, how many trimesters are there? கேள்விப்பட்டிருக்கீங்களா? During pregnancy, there are 3 trimesters. அதே சொல்லிட்டேன் நான். Okay. So first trimesterல you will be having a defect in the organ formation. The organ formation will start itself in the first trimester. So in that case, at that time, the rubella virus infected in the organ formation will be affected, and the child will be born with various malformations. Okay, that type of infection is called teratogenic infections. And the last one is iatrogenic and laboratory infections. So இது ஏற்கனவே பார்த்ததுதான் through injections, lumbar puncture and catheterization. What is lumbar puncture?
Ma'am, it is a procedure in which a needle type instrument is used to extract the fluid from the spinal canal.
Yes.
Spinal cord.
Yes, good. So in that case, if you are having infected surgical equipments, what happens? The lumbar puncture, when you are performing in the hospital, the person will be infected. The whole body will be infected. So this type of infection. So during surgery, through injections, lumbar puncture and catheterization. What's this catheterization?
Ma'am, a tube-like thing is used for people who cannot urinate naturally and they are fed by their getting fed, so that this should be used for
Okay. So these are the various major surgical procedures taking place, and in that case, if aseptic conditions are not followed properly in the laboratory and in the hospitals, there are infections which can cause. And also the laboratory personnel are at high risk of these infections. Okay, so aseptic conditions have to be followed, but in recent days there are so many blood transfusions, organ transplantation, இந்த மாதிரி நிறைய நடக்குது. So இது எல்லாமே வந்து it should be fully 100% aseptic இருந்தாதான் the patient will be safe under laboratory people and the doctors and everybody will be safe. Otherwise it will lead to infection. So what happens is most of the ICU patients are infected by இன்ஃபெக்ஷன் ஆர் என்ன சொல்றது ஐசியூல இருக்காங்க திடீர்னு இறந்துட்டாங்க அப்படின்னா அது எதனால அப்படின்னா மேக்சிமம் டியூ டு இன்ஃபெக்ஷன்ஸ் அண்ட் தட் இஸ் டியூ டு கேண்டிடா இன்ஃபெக்ஷன். கேண்டிடா இன்ஃபெக்ஷன் வந்து பிளட் ஸ்ட்ரீம்ல மிக்ஸ் ஆயிடுச்சுன்னா த பர்சன் கேனாட் சர்வைவ். ஸோ இந்த இன்ஃபெக்ஷனால தான் மேக்சிமம் த பீப்புள் ஆர் டையிங் இன் ஐசியூ ஆஃப்டர் சர்ஜரி. So aseptic condition to be strictly followed, and if the person is very less resistance, very less having very less immunity, he will be more prone to these infections and his lifespan will be very less. Okay. And